Hi, Vanessa.
Hi, Cara.
Vanessa, we're going to talk about substances today, like in great detail.
Yeah, I learned so much when we wrote this substances lesson for our school curriculum, and then learned even more when we added the Less Awkward University to our membership and did this lesson for parents. And there's a lot of ground to cover on understanding substances. We've done other episodes with Dolly Clock, which is a super awesome episode about party culture and understanding teens. We've done episodes on addiction and substance use disorder. We did a deep dive on fentanyl with Marshall E. Taylor. So there's other episodes, but this is like, we're I hate to say we put the cart before the horse, but we did a little bit put the substance cart before the substance horse because we never did this foundational episode. And if I learned a lot, then I'm guessing a lot of other people would too.
Right. And for those who feel like, gosh, my learning curve is steep here and I want to be taking notes or I want to be remembering because there's going to be a lot of fact coming your way, I want to remind people that all of this is literally written down. So if you become a member of the Less Awkward Hub, you have access to the lesson that we teach to kids in schools, but just formatted for parents and trusted adults in Less Awkward University. And the lesson is called Substance Use and Abuse. And everything we're going to talk about is written there, links out to all sorts of really reliable resources. So I would sort of be a listener and take all of this in and then use that as a place to go back to when you want to do that sort of spiraling information loop that Vanessa always talks about, where this might be your first pass around and then you can go deeper and deeper. Vanessa, I'm interested in hearing what you found most interesting about when we wrote the lessons. Like, what thing didn't you know? You know everything, Vanessa.
Can you tell my children that, Cara? Because they're a little skeptical about that statement. So what I didn't know, and frankly was never taught, and even as someone who's read a lot about this stuff, was about the classes of drugs. So that's one layer. I knew sort of like what is legally a bigger offense if you're caught with, cocaine versus marijuana. It was sort of like the urban legend of what kids thought they knew, but didn't. And then as a parent, you sort of worry about that stuff when you talk to kids. But I didn't truly understand classes of drugs based on their origin, based on what they're made of. Also, I wasn't understanding drugs that are synthetic versus, I don't know, naturally occurring, for lack of a better phrase. You will tell me what the correct terminology is there and why that's important to understand if something is synthetic or chemical, and what the concerns are there. I didn't totally understand some of the nuances in terms of, I knew about counterfeit pills and I knew about prescription pills, but there's some nuances about how prescription pills can be abused or can be confusing or accessed in a way that like I hadn't had conversations with my own kids about. So I think there's just like nuances and complexity that I wasn't really aware of. And they're actually really important when we're educating kids about drugs and having conversations with them. And it has allowed me to have better conversations in my own home. And when we talk to teenagers, have like a kind of more textured discussion with them about it.
Well, that makes me so happy. I think the way we'll go about this conversation, it will give people lots of ways in. And I think that's probably what I did, is it just opened new doors that you hadn't really considered. So maybe we start with categorization, then we'll get into specific substances. But it's important to know that there are sort of three ways that drugs get categorized. One way is by their chemical composition. One way is by where they are sold. And one way is by how they are used. And so let's just break down each one of those for a second, because all substances get sorted differently under each of those categorizations. Okay, so when you look at chemical composition, literally it is what is the chemical structure of this substance. And the reason that categorization is the most common one that's taught in medical school, for instance, is that then that signals where in the body the drug is going to have impact. So you can have a bunch of substances in one group by chemical composition, like alcohol, right? There's, wine is different than liquor in terms of how quickly it impacts the body, its concentration, but its chemical structure's pretty much the same. It's an alcohol. Or pain medications. There are a number of different kinds of pain medications whose chemical structures are related but not exactly the same, but they work in very similar ways to curb pain. So really, the most common way that substances are sorted is their chemical composition. And of course, we know that's not the end of the story.
Right. And I think, there's the sort of intended use of some of these drugs if they're prescribed or, used in the hospital setting. And then there's the off-label use. And then the whole layer of counterfeit versions of these supposedly prescribed drugs.
Let's just whip through the other two buckets really quickly before we go down that road, because I think it'll help people to think about it. And then let's go back there if that's okay. When drugs are grouped by where they're sold, Vanessa, you just made a statement that really just hits on that. There's over-the-counter drugs. They're sold without a prescription. There's by prescription that are sold by prescription. And then there's illicit. We need to know the definition of that word, illicit. Illicit drugs are either illegal or they're drugs that are legal but being used other than their intended use, which is different than off-label, because when we say off-label, often what that means is a doctor is prescribing a medication for which it has not been FDA approved, but for which there is good evidence or good reason to believe it'll work to make a condition better. Illicit is a medication or substances being used to get high. Right.
Right. So there's like testosterone cream that women in menopause use to help with libido. That's an off-label use of testosterone cream versus, a Percocet that was prescribed to somebody who is being taken by someone for whom it was not prescribed.
Bingo. So that's the sort of where it's sold path. And it's important to know that quote unquote street drugs, that's the vernacular that gets used a lot with illicit drugs. But as you keep saying, and I want people to hear you, there are a lot of prescription medications that have become substances of abuse that are not sort of the street drugs that you think of from the 80s and 90s. Crack cocaine and Percocet are both illicit drugs. This very casual terminology that we've all come up with for substances can make the conversation confusing. And just the conversation of what is an illicit drug is a super interesting one to have with your kids. The last classification, just to go a little deeper, is drugs being categorized by how they are used, which overlaps with the categories we've just talked about. But some drugs are used for medical purposes. There's a diagnosis and they're being used and then they become abused. Pain medications are the most common ones that we think of here. Some substances are used recreationally. So recreationally is the intent of getting high or having a feeling blunted, but not a medication that you're pointed to solve a specific medical problem. And all these categories overlap in such complicated ways that as people listen to these different categorizations, I would imagine what they're thinking is, well, I know this one person who, yes, they got a prescription and then it went south from there. I know this other person who never got a prescription and ended up using illicit substances for whatever reason. I know one person who will only use medications that are prescribed for them in a certain way. It's like, everyone sort of does these things differently, but it doesn't mean that the person who will only use it in the way that's prescribed for them is any more immune to this conversation, because they might be using substances that are highly addictive, right? So there's just a ton of overlap. Okay, so now that we have that, now let's go back to the question that you were starting to ask.
So, Cara, one of the things that I found super helpful as we were writing these lessons is understanding the way certain drugs work in the brain. And like we always hear about how they make people feel afterwards, whether it's alcohol or weed or, cocaine or whatever, but understanding how they work in the brain, what changes they affect in the brain chemistry to then have those downstream effects would be really helpful, because I think those are the kinds of new pieces of information people can share with their kids.
Right. I love that. And I'll also add that how we are presenting this information might work for an adult listener. But when it comes to presenting this information to kids, the much more accessible way of doing it is with short form videos that actually have some narration and some illustration. And throughout the content that we've got on the hub, we have links to so many videos that you can share with kids. So I just encourage you to poke around there, because we can talk till we're blue in the face about it, but really for younger brains to absorb this information, the visual tends to be extraordinarily helpful. Okay, so let's start with alcohol. It's so funny to me. When I used to teach in schools, it used to be alcohol and drugs, like alcohol was something totally separate and not problematic. And of course, we all know that alcohol can be highly addictive. It's also, if you start reading about all sorts of other health complications related to substances that you put in your body, alcohol in particular has been in the headlines, I would say, for the past year or two in ways I've never seen it before, associated with gut inflammation and brain inflammation, all these things. So I find it very interesting that there's sort of a push back towards conversation around alcohol in a way we actually haven't had it in front and center like this. So alcohol, big picture, Vanessa, it's the chemical found in drinks like wine and beer and hard liquor that give you a sense of well-being, relaxation, disinhibition. That's the biggie with alcohol. It is a social lubricant. You are just a little more likely to do or say something that you would have been nervous or inhibited about without the alcohol. And for some people, it is downright euphoric. But it is a dose-dependent substance, which means its effects are entirely dependent upon how much you consume. So if you consume enough, and this depends upon someone's tolerance, someone's body weight, there are all these variables, but if you consume enough, it works as a sedative, it is a downer, it is a relaxant, and of course, we all know that when too much is consumed, a person can lose consciousness, they can pass out.
I had a kid tell me recently that in their health ed class, they were given a sense of, quote, not doses, but, amounts of alcohol and kind of what the progression is in the body and the brain. And as you said, it's dependent on size and metabolism. But this kid in particular found it really helpful because, kids are savvy enough to be like, oh, well, if you tell me just don't ever do it, that's not a helpful conversation. But if you tell me, hey, here are the risks at this threshold or at this amount or in this setting, that's actually more helpful for me. Kids are often more sophisticated and nuanced than we give them credit for in thinking about this and understanding it. The issue of consent is also something that needs to be talked about in this context. Legally, if either party has consumed any alcohol, and this will be true of drugs as well, they are not legally able to give consent. However, much of kids' sexual activity happens after they have consumed a substance, which means that technically, legally, their sexual activity is not happening with consent. And that is a really complicated one to get at because, as you mentioned, Cara, it's disinhibiting. And often the two are tied together because kids might be nervous or they might be, hooking up with somebody new or, whatever the case may be. And so they use alcohol to feel disinhibited. And yet that gets in the way of it actually being a consensual encounter.
And I'll land here with something that you could do at home. Full disclosure, I never did this with my kids, and I regret not having done this with my kids. But you can take one of those charts that are very easy to find online that shows alcohol equivalency. It's that dosing that you just described. How much alcohol is in a glass of wine versus how much alcohol is in a shot versus how much alcohol is in a beer. And essentially, you can create an experiment or a project in your house where you pour out sort of alcohol dose equivalent amounts for different types of alcohol into a cup or different cups. This is, X number of ounces of wine is the same as Y number of ounces of hard liquor. And then help them connect the dots. It's the alcohol that's going to the brain. It's the alcohol that is changing how you think and how you feel and how you behave, because they, honest to God, don't know. They don't realize. And the other really important teachable moment is when alcohol is combined with caffeine. So Red Bull is the classic caffeinated drink that shows up at parties and at bars. When alcohol is combined with caffeine, the sedative effects are offset, so you don't feel as tired because you're caffeinated. But all of that disinhibition is still very much there. So you're not going to make better decisions. You still have the alcohol in your brain. You're just not going to be as tired. And there are a lot of studies that show that the risk of alcohol toxicity, being alcohol poisoned, goes up dramatically when kids consume caffeine at the same time because they don't pass out. Passing out is one way that a person stops their intake of alcohol. And if they're highly caffeinated and they don't pass out and they continue consuming alcohol, then they can become alcohol poisoned. So that's alcohol.
Can you just speak quickly to the combination of alcohol and prescription medication? Kids who are on ADHD medication or SSRIs, again, prescribed by a doctor, but when used in conjunction.
Yeah, we'll get into prescriptions a little bit more in a minute, but it is all to say that any medication that you are prescribed that impacts the way the brain works is affected when you take other substances. So if you are on a stimulant for ADHD, and you add into that mix alcohol, or frankly, any of the other substances we're going to talk about in a minute, from nicotine to marijuana to opiates, right? All of them. You are essentially mixing substances within your body and within your brain. It's called polypharmacy. And the combination can not just change your behavior, but can be extraordinarily dangerous. Right? So for kids who are on stimulants, that is the easiest out ever if those kids do not want to drink, because they can say, and it is frankly very socially acceptable. You and I hear this all the time, Vanessa. Oh man, I can't. I'm on Adderall. I'm on Ritalin. I'm on a stimulant. And they just move on. Now, for those of you wondering, well, what about the kid who does want to drink or does want to try other substances while on those medications? That is a very interesting series of conversations to have with your kid one-on-one. Have your kid talk to their prescribing doctor. You can get information from their prescribing doctor. But in general, these kids are aware of the headlines. There are celebrities and known individuals out there who have died. And it happens with way too much frequency because they're mixing substances. And so it's just that conversation of, if you've got one thing in your body, do not bring another.
So, Cara, we've talked about alcohol. Another one that sort of doesn't get the heavy headlines, but we should actually touch on is nicotine. And I want to use as an example of things that are legal for people over a certain age. So we're not talking about like prescribed or not prescribed, used in a medical setting, used recreationally. We're talking about the age gating of something that, like alcohol, is legal for people above a certain age and not legal below a certain age, and kind of how we have those conversations and understand the science behind it.
I'm laughing because I've always wanted to use the word licit. Like, if illicit is a word, isn't that licit? And that's what you're describing, but I don't think that's a word. Listeners can tell me if I'm right or wrong. Nicotine. We got to talk about nicotine. It is a chemical found in plants that works as a stimulant. In fact, we've done a ton of episodes on this, so anyone who's listened to those knows that nicotine is sometimes called a gateway drug. I'm not sure that's the right terminology, but for people who have attentional issues, because it makes their brain feel better. It works in similar ways to some of the stimulant medications that we were talking about earlier. Nicotine can be inhaled, right? Cigarette and vape. It can be absorbed. And we have talked about nicotine pouches like Zyn, not just on this podcast, but on social media. My God, Vanessa, we get more comments and shares on our social media videos about nicotine for good reason than many of our other social posts.
And nicotine can be man-made or plant, right? Like, isn't there chemically made nicotine as well as like naturally occurring nicotine?
I mean, when we talk about the chemical structure of nicotine, we're just looking at the chemical structure of naturally occurring nicotine, and anything that can be resynthesized in a lab. I mean, like this is sort of the same as bioidentical hormones, which
right?
Is
but
just
like Zyn is not. Right. Zyn isn't using like organic tobacco. Zyn is like a synthetic.
Oh, sweetheart, there's nothing organic about Zyn.
Right.
Yeah.
Right.
Oh, wait till they put the word natural on that tin.
Oh, yes.
Let's
the most unregulated
holy moly
advertising term.
Let's not forget about chewed nicotine. So remember the wads of spit that people would have in their mouth. Most forms of nicotine in the past have come with tar in them, cigarettes, right? And it is like the combination of ingredients that has been associated with cancers, oral cancers, lung cancers. So the pure, quote unquote, pure nicotine of Zyn and other pouches are upsold to kids as the clean version. Right? I know Vanessa if you're not watching this, Vanessa is shaking her head in that, like, I am deeply disappointed with you, manufacturers of Zyn.
Well, because tell people how much nicotine is in a Zyn pouch.
So Zyn, let's pick on Zyn. Zyn comes in different milligram strengths, 3 milligrams, 6 milligrams. A 6 milligram Zyn pouch, fact check me if I'm wrong on this, Vanessa, has the equivalent amount of nicotine as 3 packs of cigarettes. And people tend not to only use 1 Zyn pouch at a time every few days. They use 1 a day, 2 a day, 4 a day, 5 a day. We are talking about massive nicotine ingestion. And Vanessa is furiously fact-checking me. Please do.
Hold on.
While fact-checking, I want to talk about how nicotine works. So nicotine tells the adrenal glands to produce adrenaline. Adrenaline increases your heart rate. It increases your blood pressure. It increases your respiratory rate. Nicotine also goes straight into the brain. It raises dopamine levels. That makes your mood better, right? It increases pleasure. And at very high doses, nicotine can have side effects like nausea or vomiting, sweating, loss of balance, and seizures. So that's nicotine.
So the American Lung Association notes that 10 Zyn pouches contain 6 milligrams of nicotine per pouch, could be equivalent to smoking 1 to 1.5 packs of cigarettes or 1.5 e-cigarette pods of 2% vape juice per day.
Well, let's put a pin in that and circle back to it, because that's way lower than a lot of the data that we've seen elsewhere.
Yeah.
So we'll circle back to that in a second. But Vanessa, I think it's a perfect moment to move on to marijuana, weed, pot, whatever words you want to use, because this too falls
Grass.
because this too falls into the category of legal in many places over the age of 21.
Right. So there's a few things we need to talk about. One is that the weed that we grew up with, some people partook, some people didn't partake, was significantly less concentrated than the weed products that kids are smoking, eating, inhaling, whatever the case may be. I will point folks to our Dolly Clock episode because we go in depth on different THC products. But the reason we don't want people to assume, oh, it's all the same, it's no big deal. It's essentially a different drug today. And there are downstream mental health consequences of it being essentially a different drug, so much more potent and powerful than it was when we were teenagers. So there's mental health, there's risk of psychosis from regular use of this intense weed, and there's physical reactions, not just the fact that there's a shrinking hippocampus in reaction to regularly smoking this weed. There's also a vomiting syndrome from the hyper concentrated weed that kids can get their hands on these days. So there's really serious stuff. This is not the benign drug that was okay in comparison to the other drugs when we were, in the 1980s. This is a whole different horse.
And this hyperemesis syndrome, which you are referring to, is a really big deal. ER doctors are seeing much more of it. It's frankly not uncommon anymore because the doses are so high of THC in products that are acquired from dispensaries. In fact, I was reading last weekend that it is actually hard to find marijuana or weed that has a concentration lower than 20%. When vaped through a wax pen, the delivery of THC can be as high as 90%, 90. The scariest outcome is a psychotic break. And it is very clear that high dose ingestion of THC, the active ingredient in weed, is associated with a psychotic break. Psychotic breaks are irreversible. The brain is forever changed. There is a genetic predisposition. There is higher likelihood if you carry certain genes, but the environmental hit that tends to unmask this, bring it out, is the exposure to high concentration THC. And we know that psychotic breaks happen most frequently between 18 and 22. That is when kids tend to have left home. Maybe they're in college, maybe they're in the military, maybe they're working, and it's exposure to THC. Vanessa, before we move on, I'm going to circle back to our nicotine comment because I find it interesting, the data you read from, what was it, American Lung Association? Because that's low. So here, I'm going to read you from a number of sites that look at the math of how you figure out how much nicotine is in a pouch and how much absorption you get. A medium strength nicotine pouch has between 6 and 9 milligrams of nicotine. This is equivalent to not 3 packs. That is, I'm very happy to be fact checked, but somewhere between 5 and 10 cigarettes, which is half a pack of cigarettes. Where you get to the 3 pack is when you look at the frequency with which people seem to replace those pouches. So the average user is putting between 4 and 8 pouches in their mouth each day. So if they are consuming essentially half a pack of cigarettes per pouch, and they're doing that 4 to 8 times per day, they're getting between 2 and 4 packs of cigarettes worth of nicotine per day. That's where that average of 3 packs comes in. So that's where we got that number. I knew it wasn't from nowhere, but it's annoying to have not gotten it right. in the beginning. Okay.
I'm glad you took the do-over, Cara.
I always take the do-over, Vanessa. Thank you for acknowledging.
So let's pick it up with drugs, like what people traditionally think of as drugs. We grew up in the your brain on drugs generation with the frying eggs in the pan and not a whole lot of detail or nuance. So in an effort to educate a new generation, let's move beyond the fried eggs in the pan and let's talk about what is happening with the substances like cocaine, like heroin, and then their equivalents. And this is where it's complicated, Car, because there are equivalents used in medical settings that have similar impacts on the body, but are illicit or sold on the street. And so it's a kind of a little bit of a confusing mishmash here.
Yeah. So there's sort of three groups. They're the uppers, they're the downers, and they're the pain relievers. And I want to focus on the uppers, the stimulants, and the pain relievers, the opiates and the opioids. The downers, like that's a whole different conversation that I think we can get into separately. So, in terms of stimulants, we've talked about nicotine as a stimulant. We haven't talked about caffeine. The most abused drug in the world, I think, is what most people say. I think we have to call it that because it has the same chemical effects on the brain as these other substances. And for some reason, we've labeled the caffeine impact as good and healthy, and we've looked at all these protective benefits, but we don't do that with the other substances. I think for good reason, but we have to acknowledge the spectrum here. So caffeine, nicotine, amphetamines. So the class of drugs that includes the diet pills from the 80s, but also speed. I mean, you and I remember all those after-school specials about speed that scared the bejesus out of us.
How about the Michael J. Fox episode where he was on uppers studying for his exams?
Exactly. And there's this weird narrative that like these are drugs that allow you to be a more productive member of society. The most sort of taken to the extreme, there's cocaine, right? And anyone who retained any memories from the 1980s has lots of memories of watching or reading about or hearing about or maybe experiencing cocaine highs. Cocaine was everywhere. It is, I like to say when I think things are gone for good and when I think things are back, cocaine I think is very back. And I find it shocking that it's so back because we're going to get into fentanyl in a second and the risk there is tremendous. But all of these uppers are stimulants, and stimulants increase the presence of certain neurochemicals in the brain like dopamine. They impact focus, they impact thinking, they impact motivation, they impact mood, and generally the direction of that impact is up, up, up. They are uppers.
One of the challenges with cocaine is that it's very glamorized. So kids will have seen movies or TV shows where cocaine is being done by a main character. Think of Leonardo DiCaprio in Wolf of Wall Street. I was all of 4 minutes into that movie with my then 12-year-old, and he was doing lines of cocaine off a woman's body. And I said, oh, I think we're going to turn this off. I think we're not ready for this movie. But it's hard. It's hard to separate the sort of cultural excitement around celebrity and these kind of, films with huge cult followings and the risks and dangers. And the way we often recommend addressing it is the really scary risk that there can be fentanyl mixed in with cocaine. Fentanyl is really, really concentrated. It's used by drug cartels to cut with other drugs because it's cheaper, and because it's so concentrated, you need less of it to cut into a drug to have an impact. In order to test for fentanyl, as we've talked about in our episode with Marshall E. Taylor, you have to dissolve the fentanyl, or you have to dissolve the drug that fentanyl might be in, test it. at which case the drug is no longer useful. I use that in air quotes.
You mean like snortable?
Snortable. So when we talk to teenagers about pills and powders, cocaine as a powder, we tell them there is a good chance there is fentanyl in a cocaine that somebody passes to you at a party and says, oh, this is great, take it. One mistake, one, a snap decision to try it, and it's deadly. And, we were joking about the eggs in a frying pan from the 80s, but we are here to say this is not an exaggeration. There are children and young people across the country who tried something once, a pill, a powder, and died from fentanyl poisoning. And this is a conversation I have in my own house. And this is a conversation we encourage people to have and to acknowledge, hey, I don't usually go this route, but this is a moment to actually address something very scary.
And even if there's not fentanyl in the cocaine and other stimulants have very well-known side effects like anxiety, exacerbating anxiety disorders, or pulling out new anxieties, jitteriness, insomnia, can't sleep, and weight loss. And if you want to get into conversation about nicotine use or cocaine use or amphetamine use, I actually find the weight loss argument or the weight loss conversations a very interesting way in, because we've talked a lot on this podcast about body image issues among boys. And one of the things that boys are looking to do often is to gain weight or to not lose weight. And it is when you can point out that stimulants increase all sorts of things, including metabolism, that suddenly boys will go, oh, well, I don't want to lose weight, so I'm going to opt out of this class of drugs. It's very interesting.
Not to mention a risk of heart attack
the
risk, very, very serious risk of addiction, right? Nicotine is the most addictive drug. We all know people who have struggled with cocaine addiction because, it's fun, let me just try it. And all of a sudden, their bank account is empty and their lives are turned upside down by cocaine addiction. Pills, uppers, super, super addictive. So this is the kind of thing where we can say it, kids might not be able to hear it, but it's really important to emphasize the addictive nature.
And speaking of addiction, we're going to move on to opiates and opioids, which are generally the class of painkillers or narcotics, but they also can work as downers. There's a whole category of drugs that are the C to the amphetamine saw, if you will, where this is another loop that people get stuck in. But we're going to go very specific with opiates and opioids. One thing that I really found confusing for a long time until I stopped and decided to commit this to memory was the difference between an opiate and an opioid. So just linguistically, you were asking about organic and natural Zen earlier, Vanessa. And actually, when it comes to this class of drugs, there is a distinction between the version that is found in nature, extracted from plants. Those are opiates, O-P-I-A-T-E-S, opiates. Whereas the ones that are made in a lab synthetically are opioids, O-P-I-O-I-D-S. So nature has an A, opiates has an A, okay? Lab derived, I guess lab also has an A, not very helpful, but lab derived is opioids. Why is this distinction important? Well, I mean, it's important in terms of the classification. The plant extracted versions are like opium, morphine, codeine, heroin. Okay. These are not like because they come from plants, they're benign. Don't kid yourself. But the synthetic ones, I don't want to say they're more addictive or more worrying because frankly, heroin is extraordinarily addictive and extraordinarily worrying, but there's a different kind of tweaking that happens with synthetic products by virtue of the fact that they are synthesized in a lab, and that this is the family of oxycodone and fentanyl and methadone, methadone being the synthetic opioid that was designed to help addicts curb their need for opiates and opioids. So these are designer drugs, if you will. They're literally designed in a lab. Any and all of these can be cut with fentanyl. So don't kid yourself about that distinction. All of these can disconnect pain signaling in the body. So for people who do have chronic pain or acute pain that is not tolerable, often you'll be given an opioid, and generally it could be an opiate too, like morphine, and it will actually blunt the pain response in the body. And at the same time, everyone who's taken one of these medications knows it changes the way your brain feels. You feel a little more relaxed. You feel a little more happy. A lot of people say they don't feel like themselves. They don't love how they feel. And that's because they can feel tired, confused. Eventually, if you have enough or too high a dose, you can get super constipated. Your breathing can slow down so much. These are downers, remember, that you can actually not get enough oxygen in. Like there's a whole continuum of things that can happen if you take too much or take too much over an extended period of time.
And for the population that we focus on, right, tweens and teens, one of my biggest fears are the kids who have surgeries, an ACL repair, Tommy John surgery on an elbow, and they're given these prescribed these pain medications post-surgery to handle the pain. And what has been happening, and it's just so devastating and upsetting, is that kids then get addicted to these pain medications. And when the prescription is no longer there, they seek out illicit versions of these drugs, and they are then suffering from substance use disorders. And what started as a desire to get better, right, to get healthy, to have these repair surgeries, ends up with a kid who then has a dependency that can destroy their lives. And it's so sad to me. And it's something that I worry a lot about because I know lots and lots of athletes who end up having to have these surgeries. And I sort of probably inappropriately will say to their parents, hey, just please keep in mind, like get them off the pain medication as soon as you possibly can.
I mean, Vanessa, I want to vent for a second and say that when my kids went and got their wisdom teeth pulled, they were given prescriptions. I said, I don't want any of these opiates. I don't want, like, my
I
kids
said the
don't need
same
them.
thing.
And not only did they ignore my request, did the surgeon ignore my request, but handed my child a prescription on the way out the door for 30 pills.
Oh my God.
30. And I actually marched right back in there. And I was like, this is irresponsible. This is not okay. And, it's taking a lot of education and a lot of rewiring of this muscle memory that surgeons in particular have often been told, just, give more pills out the door because it saves you the phone call later. And they're really busy caring for patients and may not be as aware as they need to be, although I find it hard to believe that they've had their head stuck so far in the sand, and it really makes me mad. But why would you ever write for 30 of these pills? I mean, I don't know what's the worst case scenario, that the kids take them, right, and develop dependence, or that they sell them because these drugs have street value.
Right.
And
or there's some other kid in your house who finds them and takes them. I mean,
Bingo.
I literally won't even take them home. I will say, I don't want them in my house because knowing my brain, I'll forget they're there. And there's some kid in my house who finds the pill. And this is just a quick plug. If you do have these prescription drugs in your house, make sure they are locked up in a lockbox. They're not just sitting in medicine cabinets, because if you have kids in and out of your house, they get real curious And you do not want to be responsible for a kid taking some sort of prescription medication from your house.
And good luck getting rid of them. They should not be thrown in the trash. They should not be flushed down the toilet because they are introduced into the water supply. These actually need to be taken to a place that will accept them, like an emergency room, although I've tried that and the emergency room doesn't always accept them. There are drug take-back days where, sort of like your batteries and your old electronics, you can drop them off somewhere that's supposed to be safe, where they'll collect them and dispose of them in an appropriate way. But I'm just flummoxed. Like, I think that the easiest place to start solving some of these problems is to change the number on the prescription from 30 to 3. Right? Like, let's get appropriate here about how we dose these drugs. And when we teach in the classroom, kids are irate because we will talk about these different drugs and medications that are given. And we are not saying, my kid was given. We're like, have any of you had an experience where and there are kids who are like, yes, I was given a whole bottle of this stuff. And why should I be given this? The exposure puts me at risk. Now, all that ranting aside, managing pain is incredibly important because when we don't manage our pain responsibly, there are a whole series of other things that can happen. So I am not saying that these medications are the bastion of evil and should not be used. I just encourage you to be in close communication with the prescribing physician and watch what's being taken when and how. And Vanessa, as you said, lock it all away. Do not trust that these medications are not going to make their way either around your house or around your kid's friend group, because there is very real street value and social cred to having access to these substances.
We know this is a lot of information, but it's so important, as you can tell from our impassioned pleas. And also, this is really a place where understanding how things are different now is critical. Understanding what Zin is, understanding what fentanyl is, and tiptoeing in, and maybe sometimes heavy-footed, elephant footing into these conversations is really critical. Don't expect your kid to clap their hands with glee that you are addressing anything from nicotine to alcohol to opiates and everything in between. But just say to them, listen, this is my responsibility as your parent. I'm going to do it quick. I'm going to give you a couple pieces of information. I'd love to hear your thoughts, but this is not a may do, this is a must do, and we're going to have this conversation.
Great resources that all live on our site and our hub include The Sci Show with Hank Green. He does individual episodes that last anywhere from 7 to 12 minutes about each of these substances. ASAP Science does a fantastic job of covering what these substances do in the body and in the brain. I think those are our two favorite. Wouldn't you say, Vanessa?
Yep. So good luck. Let us know how it goes. And we're about to go call our kids and have yet another conversation about substances. Thanks, Cara.
Bye, Vanessa.
Thank you so much for listening. You can email us with questions, feedback, or episode requests at podcast@lessawkward.com.
If you want to learn more about what we do to make this whole stage of life less awkward for everyone involved, our parent membership, our school health ed curriculum, our keynote talks, and more are all at lessawkward.com.
And if you want products that make puberty so much more comfortable, visit myumla.com.